Hello and welcome to the new patient orientation for Revelation Health and Wellbeing. I want to thank you guys so much for being here, and hopefully you came with lots of questions and you're curious to know a little bit more about hormones and how to maintain a healthy, youthful lifestyle. And that is exactly what we're going to do here. Just want a few housekeeping things. If you've got any questions, please feel free to type them in the chat. We're going to keep everybody on mute. We will try to answer all the questions during the presentation, either in the chat or at the end. If we've got time, we'll answer a couple live. And if we don't get to your question, we promise to respond after the webinar is over and answer those questions. So without any further introduction, let me introduce Dr. Mark Heckler.
Hello, everybody, and welcome to our new patient orientation. So today we're going to kind of get to know everybody a little bit about what we do, let everybody know what we're doing, what we are going to provide for you, and kind of give you a little education about hormone therapy in general. So we'll kind of get started here just to kind of let you know that, for starters, aging is a treatable and preventable disease. So that is not something that is necessary for everybody to take into consideration. So we want to explain how that's an option for you. So why did we get into hormones? I got into hormones, my wife Tandy and I, essentially because it's certainly something that is going to help improve the quality of our lives. We started out with her in the functional nutrition and functional medicine realm, and so she began to get interested in that. And I was doing my traditional Western medicine practice with ear, nose, and throat. And she approached me about, thyroid hormone optimization. And I was the old training school of training that was, it's one of those things where if the labs are normal, well, then that means your thyroid's normal. So, I don't know why you're fatigued. I don't know why you have all these troubles and problems with symptoms of low thyroid. But we soon found out that it's more than just being normal. It's more about being optimal. And so the deeper we dug, the more information we got about the benefits of general bioidentical hormone replacement for folks and how that just improves the quality of life. So today we want to kind of let you know that this presentation is totally about you. It's basically you're here because that's what you are totally interested, and you've got your curiosity up, and now you want to know more. So it's basically you're sure that you just want to be committed to living your best life, and being healthy and optimal, and but just taking care of yourself and just trying to get answers about, well, what do I need to do to make myself as healthy and feel as good as I can, even into my older ages? So this is kind of what we're going to learn today. But first, just a little brief rundown about me. I started, like I say, in ear, nose, and throat, and doing facial plastic surgery. I also had a emergency room medicine training, so that was also something that gave me a good background. And a recent empty nester. Of course, we've got 5 children between Tandy and I, so we've got a full field there. We basically decided that, I'm pretty active, and at this point, I like to optimize my performance and my health, but not only myself. This is something that I could spread the word, and we could help a lot more folks doing this too. So we just decided to dedicate our career to doing that. The World Lake, my education was through World Lake Medical and, the Academy of Preventative and Innovative Medicine. Of course, the Institute of Functional Medicine has been a prime component too, but also the American Academy of Anti-Aging Medicine. That's also something that we're heavily into. I'm a pilot, of course, and do a marathon run. So that's been something that I've done for many years now. And Tanny and I own our own practice here in Kansas City. So what are we going to cover today in this? We're going to talk about hormones, basically the services and things that we offer, how you can get started and kind of what to expect from us, So then this is a journey. This is a navigation journey that we're going to help you through. So what are hormones? Basically, little chemical messengers that are secreted by tissues and organs in our body and glands, and they basically will affect every single cell in your body. So all multi-trillions of your cells, they're all affected from head to toe, as you'll find out. So what do they regulate? They regulate a lot of things: growth and development, our metabolism, even our appetites, our attitude, with anxiety, depression, mood, stress, your sexual function, reproductive cycles, fertility, of course, and then, your heart rate, glucose levels, and your sleep. Sleep's a big one too, even your body temperature and just general physiology. So if this picture here kind of says it all, the imbalanced look is the way I like to look at that. These folks have low energy, they have difficulty concentrating. There's a suggestion that there's a low libido with, poor sexual satisfaction. And, there's weight gain is a common problem with, sleep issues also being an issue, and just general muscle fatigue and muscle wasting. So that happens as we get older, our hormones become less effective and less concentrated. So that's something that is the reason why we're getting into this. So you may want to ask the question, why does my primary care physician give me hormones? Basically, they're just not trained. They're just traditionally, they just don't know about them that well. And it's not because they're not a smart individual. It's just they were not trained in that. It's deeper than that. It's something that we don't get taught in medical school, essentially, to this depth.
I think another thing, real quick, to interject is the other piece is that traditional medicine is taught to treat disease. And this is a different outlook where we are looking to prevent disease and optimize your health. So it is just a different way of looking at health in general.
All right. Yeah. So it's more about healthcare than disease care. Exactly. So, and then of course, there's been a lot of misinformation that was spread back in the WHO report back in 2004. So there's a lot of misinformation that is continued to be out there, and that's not only with the physicians but also online, social media. There's just a lot of misinformation about that and confusion. But a lot of doctors just don't bother to get the hormones tested, and if they do, they see a normal level and they say, oh, okay, well, you're okay. I have to be used to it. Just something that's part of aging. That's a bad excuse, but that's unfortunately what you hear. So they're just, an uninformed doctor is what's common. I mean, obviously I was uninformed initially too, until I got more informed and get more educated. So what is the difference between normal and optimal? Well, you've got normal labs, which all the different lab companies will have. These lab companies will have a different ranges of their normal too. And then you'll come back with these ranges. So what that means is that you take a 93% of our population of individuals that are out there have suboptimal or metabolic dysfunction. They have metabolically ill. And that group of folks, you take those individuals that have gotten their labs drawn, and that's what you're comparing yourself to, is this sicker group, if you will. And there's a lot of reasons for that, but we can go into that later. But this is certainly the reason why normal levels can be suboptimal levels. We would like to be in the higher levels like we were younger. So I want to take my levels of my testosterone or my estrogen or my thyroid back when I was in the 30s. I want to feel like that. I don't want to feel like I'm 60. I want to feel like I'm 30. And, not too many people that are 30 want to feel like they're 60. So it's just that way. But our philosophy is more about optimizing your current hormone levels so that you can feel your best and perform your best. So which hormones are we talking about? We're talking about, for men, it's testosterone. For women, it's also testosterone, estradiol, progesterone. And then for both of us, both of the sexes, we're talking about thyroid and vitamin D. Yes, vitamin D is a hormone. So, skepticism still persists. So misinformation is a big driver of the skepticism. So let's just dispel some of these common myths. So what are they? Hormones that cause cancer. They may cause heart problems, strokes, thick blood, and clots. But that is not the case. So the truth about hormones, the fact is that hormones are not only healthy, but they are absolutely vital for living a long, healthy life that's disease-free so that you can feel optimal and feel better. You know, there are no well-done studies that are placebo-controlled, double-blind studies that show that there's any adverse or negative effects or risks for bioidentical hormone replacement. And the key word is bioidentical hormone replacement. So most studies are going to show an improvement in general well-being, as well as an improvement in your age and management of that. And plus, don't you want to feel happier, stronger, sexier, and even younger? Yes, please. All right. So, as a matter of fact, yes. So hormone replacement therapy will improve all these health aspects for us. And they're going to do that by helping with, reducing your risk of various different types of cancers. Even improving the eyes with macular degeneration, improving your anxiety and depression symptoms, reduce your insulin resistance, improving your visceral fat, which is very important for metabolic health. And, improving your dyslipidemia, erectile dysfunction, and then, urinary continence issue problems specifically for females. And, generalized improvement in vaginal health with reducing urinary tract infections is very important too. That's a good, important part of the hormone replacement. But chronic fatigue, who doesn't have that sometimes? So that's also something that's improved with hormones and various different types of autoimmune disorders too. Fibromyalgia, rheumatoid arthritis, and lupus, just to name a few, as well as even Hashimoto's thyroiditis. So, what's the bottom line? Bioidentical hormone replacement therapy. It's exceptionally safe and it is effective. It is proven that time and time again. There's so many studies that prove its safety and its effectiveness. So the treatment will reduce your risks of a lot of different types of aging and chronic disease. It's going to improve that quality of life. And, it's best when these treatments are individualized, because specifically individualized for each person and what they want, what their goals, what they are trying to achieve. Not everybody wants to have the same goals, but some people have specific things it's like, oh, I'm tired of feeling tired, or, I want to feel more sexy, or I want to improve this health or that health. I want to feel stronger. So there's a lot of reasons why they're individualized, but we strive to optimize, not just normalize. A lot of folks will be in the normal levels, like I talked about, but if you're not optimized, that's important.
And I think this is really key here, that hormone experts treat the patient, not the blood test. And this is where that optimal comes in, and where we are really in this one-on-one working relationship with you, helping to see where your symptoms are. And that is what we're going to be treating more so than your blood levels.
Correct. Yeah. So what about thyroid? That's just one of many types of hormones that are out there, but the thyroid is a very complicated gland, and it has been so misunderstood for years. It has been that way for as long as I can remember. There's just a lot of misunderstanding about what thyroid does, but also that, the balance that we have in our thyroid. So the levels, once again, may be considered to be normal. And I know on multiple occasions in years past that I've drawn labs on somebody expecting them to have, abnormal thyroid labs because of their symptoms, but yet they come back in the normal range. And that's where the optimal versus normal thing comes into play. But T3 is commonly one of those that's significantly overlooked constantly. It's not on the radar. TSH is something that's more commonly evaluated by the general Western Medical Society, essentially. So that's also a very important thing, because if we can optimize your T3 levels, you're going to optimize and feel better. You're going to have a lot more energy. So, but hypothyroidism and thyroid deficiency are not necessarily always identical. So that's something you got to remember. But the thyroid is just a very complex gland that controls so many different things from our heads to our toe. So it's, it's got to do with mood and your anxiety and brain fog. You can have low energy, weakness. It can even affect your GI tract with constipation and problems with your gut microbiome. You can have menstrual irregularity. You can have hair, skin and nail issues, as well as, muscle and joint pain even from that. So, but even after we get your hormones optimized, you're still going to need somebody that's on your side that can help you navigate your symptoms and where you need to be and where you want to go. And it's an ongoing thing. It's not something you can just, okay, yeah, this is low, we're going to give you a pill. No, we're going to give you medications. We're going to give you the hormone replacements. We're probably going to adjust that, but are also going to look at other factors that affect how your cells see the hormone level in your blood. And that also makes a difference. There's a lot of contributing factors. So just because you take a medication, because you take a hormone replacement, doesn't mean you're going to feel better. There's other things that need to be looked at too. So complicated. So hopefully we got some questions that you've come up with. But it's coming up soon, so write those down or be ready to put those into the chat, and we will be happy to answer those. So, well, what's coming up? What's the next step? What happens when I'm ready to get to feel healthier and feel better?
So before you book your appointment, we'll have a quick call to make sure that what you're needing is what we can provide. And if you're here, chances are highly likely that we can help you. So we'll have a conversation and kind of go through these things in a little more detail, but we'll get some blood work ordered for you and we'll get you set up in our EMR. You'll do some health history. You'll answer some questions about your symptoms, and then you'll come in for your appointment. Typically, after you get that blood work done, it takes about 7 to 10 days. So we want to make sure that the blood work is back and we've had time to go over your health questionnaires and the lab work so that we're all set and ready to go when you come in. We are going to review all of that with you. We'll create a treatment plan that is specific for you. If you need any prescriptions, we'll get those started.
Supplements too.
Or supplements. There will also be a pretty extensive set of lifestyle recommendations, things that you can do to improve your optimal performance overall. We also do we do a physical exam. We're going to take some measurements. We're going to do some functional testing like grip test and maybe a sit to stand test so that we can know where you're at and then down the line check and see what kind of progression you've had.
Right. So, but these, it's very important to know that this is really comprehensively customized for you and your needs and your problems. You are seeking us, you're seeking our advice and our knowledge, and we are providing you with the direction, plans, the roadmap to get where you want to go.
But it is really, I do want to just mention also along these same lines is that you are your best advocate, and we want to work with you in developing and honing in on that intuition that you have about your body and what is right for you. So it is absolutely a collaboration.
Right. And some it's just about metabolic health, wanting to get, stay healthy and be active in your, your older ages. Some it's more about, okay, well, now I want to increase my performance. I want to run my best 10K or my best half marathon or a marathon. That's how I've gotten a lot more into it, is like, I want to be more effective and more consistent and feel stronger at the finish line after 26 miles. So that's, everybody's different on where they're at. So.
Well, thank you so much. And Jody, do we have some questions?
We do have some questions. So I'm just going to pick a couple that I think more than one person are probably thinking of. So the first question that you probably get a lot is, do you guys take insurance?
So we actually do not take insurance, and there are a couple of reasons why we don't. Typically, insurance companies will require there to be some indication of you already being unhealthy to do a certain lab. And so what we found is that it is much easier to just do this self-pay, get the discounted rate that we get from a self-pay perspective, than try to submit to insurance and get denied. And then you have to pay, twice as much, if not more, for that same lab that we can get you at this discounted rate.
Gotcha. Okay, perfect. Appreciate that. And you kind of went over this, but somebody did ask, how should I prepare for my appointment?
Yes. So preparing for the appointment, the things that we need for you to do is answer those health questionnaires for us. It's always helpful for us to have that ahead of time so that we can kind of get a good idea of what's going on and know what questions to ask to dive in a little bit deeper. We also want to make sure that that lab draw gets done 7 to 10 days before your appointment, so that we have all the information that we need to make that appointment, the best it can be.
Okay, great. Another question, can you explain the difference between synthetic and bioidentical hormones?
Yeah, synthetic hormones have a little more of a track record of that is where the issues with safety somewhat came into the play years ago. But synthetic hormones are the ones that are basically created and made in a test tube, if you will, by the pharmaceutical companies. Whereas, bioidentical hormones are just that. They're bioidentical. They are identical to human hormone replacement therapy. And so you're going to have a molecule for molecule, atom for atom similarity, in which, as a result, that is going to give you more of a specific improvement and result.
Got it. Okay. This one you touched on as well. My primary doctor says they don't do hormone replacement. So why not?
Right. Because, like me originally, they were not trained in bioidentical hormone replacement. And what we have learned and what we've been taught in medical schools and residencies was very basics. You know that this gland makes that hormone. That's it. You don't understand the differences between what it means to be optimal, and that the fact that as we age, these levels continue to dwindle and go down. And so, bioidentical hormone replacement is that we're trained to replace what you are not getting effectiveness of at this point. And at this point, we also have a lot more specific training in regards to how to make you feel better.
Yeah, I think another thing that the difference between your primary care and what we're doing is primary care, again, is purpose to treat disease. And what we're doing is not necessarily treating a disease. You have normal blood work. You don't have a code that goes with a disease to actually do that treatment. So primary care, there's no way to bill for that or, get reimbursed. So that's a little more of the insurance issue too.
Right.
So kind of going, this is a great lead into this last question we'll talk about today. So this person is asking, what is normal hormone levels? So you touched on normal versus optimal, but how do you even know what normal is?
Yeah. Normal levels. Well, there's a range. It's a reference range that comes from the labs. It does vary. It varies from lab to lab, but optimal, like I mentioned previously, is more of a true, where's your level need to be to feel better? If you're 30, do you want to feel like you're 40, or do you want to feel like you're in your 20s? If you're 50, do you want to have fatigue. You don't want to. Do you want to feel more like you're in your 30s and 40s, so versus your 60s? So that's the difference. Essentially, optimal is going to improve your quality of life and prevent a lot of chronic disease.
Hmm. Awesome. Okay, great. Well, we are almost out of time. If you did not get your questions answered and you have some more, or you just want to talk to Dr. Heckler or to Tandy, go ahead and click the button that you see on the screen and you can send them a message and I'm sure they'll get back to you as soon as possible. Guys, thank you so much. This has been a very informative, really eye-opening presentation. And I'm sure I speak for your audience when I say that we learned a lot today. Thank you so much.
Thank
Thanks,
you.
Debbie.